the cornerstone of cardiovascular longevity, a comprehensive analysis of heart-healthy dietary strategies and 5 essential foods. 1. Introduction. Diet as the primary modifiable factor in cardiovascular health. Cardiovascular disease, CVD, encompassing coronary artery disease, heart attack, stroke, and heart failure, remains the leading cause of morbidity and mortality globally. The devastating consequences of CVD extend beyond acute events, significantly contributing to chronic conditions such as vascular dementia and cognitive decline. While genetics and certain non-modifiable risk factors play a role, the overwhelming scientific consensus is that diet constitutes the single most critical and powerful modifiable factor within an individual's control to prevent, manage, and even reverse the progression of arterial and cardiac pathology. Adopting a heart-healthy dietary pattern early in life is not merely a reactive measure for managing existing symptoms, but a proactive strategy for achieving extended longevity and maintaining high functional capacity throughout the lifespan. Leading public health organizations, including the American Heart Association, AHA, have shifted their focus from merely treating disease to aggressively promoting preventative lifestyle strategies. Their scientific statements emphasize that foundational dietary patterns, such as the Mediterranean diet or the DASH, dietary approaches to stop hypertension eating plan, are non-negotiable for vascular protection. These diets share common characteristics. They minimize saturated and trans fats, refined sugars, and excessive sodium, while prioritizing high-fiber, whole, and nutrient-dense foods. This comprehensive analysis will explore the overarching dietary principles recommended by major health bodies and dissect the crucial roles of 5 highly effective, easily integrated foods specifically celebrated for their scientifically demonstrated benefits in lowering cholesterol, reducing inflammation, and optimizing blood pressure. 2. Foundational dietary principles for cardiovascular protection. The AHA and similar clinical groups advocate for a holistic, plant-forward eating pattern that addresses the core drivers of CVD, inflammation, lipid imbalance, and hypertension. IONA prioritizing unsaturated fats. The cornerstone of a heart-healthy diet is a focus on unsaturated fats, monounsaturated, and polyunsaturated fatty acids, MUFAs and PUFAs, which replace harmful saturated and trans fats. Unsaturated fats improve blood cholesterol profiles by actively helping to lower levels of bad low-density lipoprotein, LDL cholesterol, while supporting levels of good high-density lipoprotein, HDL cholesterol. Sources include olive oil, nuts, seeds, and fatty fish. Pea fiber. The cholesterol scrubber. High intake of dietary fiber, particularly soluble fiber, is essential. Soluble fiber binds with cholesterol in the digestive tract, preventing its absorption into the bloodstream and facilitating its excretion. Fiber also promotes gut health, which has been increasingly linked to reduced systemic inflammation, a key contributor to atherosclerosis. Recommended sources include whole grains, legumes, fruits, and vegetables. See micronutrients for vascular health. The diet must be rich in micronutrients that support vascular function. Potassium counteracts the effects of sodium, helping to lower blood pressure. Found in bananas, potatoes, and beans. Magnesium supports healthy blood vessel relaxation and heart rhythm. Found in nuts, seeds, and leafy greens. Antioxidants, vitamin C, carotenoids, combat oxidative stress, which damages arterial walls and initiates the atherosclerotic process. D. Sodium restriction. High sodium intake is a primary driver of hypertension. A heart-healthy diet emphasizes consuming less than 2,300 milligrams per day, and ideally targeting 1,500 milligrams per day for those with hypertension. This requires minimizing processed and packaged foods, which are the main sources of hidden sodium. 3. 5 essential heart-healthy foods for daily integration. The following 5 foods are championed by cardiovascular nutritionists for their specific Measurable and easily integrated benefits in managing heart disease risk factors. 3.1. Food 1. Olive oil, Olea Europea, the renowned saturated king olive oil, particularly extra virgin olive oil, EVU, is not merely a cooking medium but a bioactive food central to the Mediterranean dietary pattern, which is perhaps the most clinically studied and successful heart-healthy diet in the world. Nutritional and mechanism profile. High monounsaturated fat ratio. EVU boasts the highest proportion of monounsaturated fatty acids, MUFAs, primarily oleic acid, among commonly used oils. MUFAs are proven to promote healthy lipid profiles by replacing saturated fats in the diet. Cholesterol modulation. Oleic acid consumption is consistently linked to a reduction in harmful LDL cholesterol levels, while preserving or slightly increasing protective HDL cholesterol. This favorable shift in the lipid ratio directly lowers the risk of plaque formation, atherosclerosis, polyphenols, and anti-inflammation. EVU is uniquely rich in polyphenols such as oleuropein and oleocanthal, which are potent antioxidants. Oleocanthal, in particular, has anti-inflammatory properties similar to ibuprofen. Chronic inflammation is the initial catalyst for arterial damage, and the regular intake of EVO's polyphenols acts as a shield against this arterial injury. Endothelial function. EVU consumption has been shown to improve endothelial function, ability of the blood vessels to dilate and contract properly, which is critical for maintaining healthy blood pressure and smooth blood flow. Application. The AHA recommends using healthy oils generously. This translates to replacing butter, lard, or vegetable shortening with EVU for sautéing, and crucially, using it as the primary dressing for salads, vegetables, and bread dips to maximize the intake of beneficial polyphenols in their uncooked state. Consumption of 1 to 3 tablespoons daily is a common target for therapeutic benefit. 3.2. Food 2. Quinoa, Chenopodium quinoa, the whole grain revolution. Quinoa, technically a pseudo-cereal, is recognized as a complete protein and a highly valuable whole grain alternative, surpassing many traditional grains in its ability to support cardiovascular and metabolic health. Nutritional and mechanism profile. Exceptional fiber content. Quinoa is packed with dietary fiber, which, as a cholesterol scavenger, directly aids in reducing serum cholesterol levels by preventing its reabsorption in the gut. Antioxidants and essential minerals. Quinoa is rich in beneficial antioxidants and essential minerals, including magnesium and potassium. Magnesium plays a key role in relaxing blood vessel walls and modulating blood pressure, while potassium helps balance sodium levels, contributing directly to the management of hypertension. Anti-inflammatory action. A meta-analysis of studies highlighted in the Journal of Medicinal Food indicated that consuming quinoa significantly reduces markers of systemic inflammation and lipid peroxidation, oxidative damage to fats, both of which are central mechanisms in the development of atherosclerosis. Metabolic syndrome control. Its low glycemic index, coupled with its high protein and fiber content, supports stable blood sugar levels, mitigating insulin resistance, a core feature of metabolic syndrome, which exponentially increases CVD risk. Application. The IHA recommends consuming at least 3 servings, equivalent to approximately 1.5 cups cooked, of whole grains like quinoa daily. Quinoa can easily replace white rice or pasta, serving as a versatile base for meals, or be incorporated into breakfast bowls or salads. 3.3. Food 3. Legumes, beans, lentils, peas, the fiber and protein powerhouse. Legumes, a broad category encompassing all types of beans, lentils, chickpeas, and dried peas, are inexpensive, nutrient-dense staples that offer powerful, compounded benefits for heart health. Nutritional and mechanism profile. Soluble fiber for cholesterol lowering. Legumes are arguably one of the best dietary sources of soluble fiber. Soluble fiber creates a viscous gel in the digestive tract, trapping cholesterol and bile acids and driving their excretion. Regular legume consumption has been clinically shown to significantly reduce LDL cholesterol levels in numerous interventions. Trials. Blood pressure management. Legumes are naturally low in fat and sodium when consumed in their whole form, not canned with added salt, and rich in blood pressure regulating minerals like potassium and magnesium. The high fiber content also helps to control blood pressure by reducing systemic vascular stiffness, protein, and satiety. They serve as an excellent plant-based protein source, allowing individuals to replace saturated fat-heavy animal proteins, like red meat, with a healthier alternative. This substitution strategy is essential for minimizing saturated fat intake, the primary dietary driver of high LDL levels. Application. Major health guidelines often suggest consuming 1 to 3 cups of cooked legumes per week. They are easily incorporated into soups, stews, salads, or pureed into healthy dips like hummus. Choosing low-sodium or salt-free canned varieties or preparing from dry beans maximizes their heart-healthy profile. 3.4. Food. 4. Walnuts, juglans. Regia. The omega-3 nut walnuts are unique among nuts for their exceptionally high content of the plant-based omega-3 fatty acid, alpha-linolenic acid, ALA, making them an indispensable component of a cardioprotective diet. Nutritional and mechanism profile. ALA and antithrombosis. ALA is a polyunsaturated fatty acid that the body converts into the marine omega-3s, EPA and DHA, albeit inefficiently. Regardless of conversion efficiency, ALA itself has proven benefits. It helps reduce triglycerides, a type of fat in the blood linked to CVD risk, and exhibits antithrombotic properties, meaning it helps prevent the formation of dangerous blood clots that can cause heart attacks and strokes. Vascular endothelial protection. Regular walnut consumption has been shown to improve the elasticity and function of the blood vessel lining, endothelium. Healthy endothelial function is the first line of defense against the development of plaque. Inflammatory marker reduction. A landmark study published in the Journal of the American College of Cardiology found that long-term, regular walnut consumption over 2 years significantly reduced inflammatory biomarkers such as VCAM1 associated with chronic coronary artery disease, effectively dampening the inflammatory process driving the disease. Mineral and antioxidant boost. Walnuts also contain a host of potent antioxidants and minerals, further bolstering their role in combating oxidative stress and promoting vascular resilience. Application. Due to their high caloric density, portion control is vital. Experts recommend limiting intake to about 1 ounce, approximately a quarter cup or 7 shelled walnuts daily. This amount provides the necessary ALA without contributing to excessive caloric intake. They are best consumed raw as a snack, added to oatmeal, or sprinkled on salads. 3.5. Food. 5. Fatty fish, salmon, mackerel, sardines. The EPA-DH, a source fatty. Cold water fish are the most direct and potent source of the long-chain omega-3 fatty acids, eicosapentinoic acid, EPA, and docosahexaenoic acid, DHA, which are foundational to cardiac health. Nutritional and mechanism profile. Triglyceride reduction. EPA and DHA are exceptionally effective at significantly reducing plasma triglyceride levels, a key risk factor for heart disease. Anti-inflammatory and antiarrhythmic effects. Omega-3s are powerful anti-inflammatory agents, helping to stabilize atherosclerotic plaques and reducing the likelihood of plaque rupture, which is the immediate cause of most heart attacks. They also possess antiarrhythmic properties, helping to stabilize the heart's electrical rhythm and reducing the risk of sudden cardiac death. Vitamins and amino acids. Fatty fish are excellent sources of vitamin D and a balanced profile of amino acids, further supporting optimal heart metabolism. Their low saturated fat content makes them a superior protein source compared to most red meats. Application. The IHSA recommends consuming 2 servings, approximately 3.5 ounces or 100 grams, cooked, of fatty fish per week. Baking, grilling, or steaming are preferred preparation methods over frying to preserve the integrity of the omega-3s and avoid adding unhealthy fats. 4. Conclusion. The power of portion control and consistency. The evidence unequivocally supports the conclusion that diet is the most powerful lever for achieving a healthy heart and mitigating the risks of coronary disease and stroke. The foundational strategy involves adopting the principles of the Mediterranean or DASH diets, prioritizing unsaturated fats, high fiber, and essential minerals while severely restricting sodium and refined sugars. The strategic, consistent incorporation of foods like olive oil, quinoa, legumes, walnuts, and fatty fish provides a direct, evidence-based approach to lowering harmful LDL cholesterol, reducing inflammation, stabilizing blood pressure, and preserving the delicate function of the vascular endothelium. However, the benefits of even the healthiest foods can be negated by excessive portion sizes, emphasizing that portion control and unwavering consistency are as critical as the choice of food itself. A disciplined, informed dietary pattern is the most effective prescription for cardiovascular longevity.